Good evening, everyone. Welcome to this live session. I'm doing a live session after a long time. In this session, I'll give you a quick overview of clinical approach to diagnosis. This pertains mainly to those of you who have family who is interested in entering medical school. Most of these are applied in terms of medical interview questions, and we will also have an overview of how the different systems or different organs in our body function. So depending on where you aim to join and the university where you've applied to, the interview system might vary, but invariably when you are applying for a medical interview, there are some questions which are related to how the human body works, and also there are many questions related to the clinical decision making process. You might have submitted your personal statement or CV, which is tailored to your interest in medicine. You would have mentioned a few aspects there, which is relating to your experience in hospitals when you're shadowing medical colleagues. And also, you would have entered details about any specific reason why you're interested in medicine. You could have elaborated on any projects you did, any specific courses you did. So these are all specific areas that will be questioned during the interview. The work experience usually covers both inpatient and outpatient care, so you should be clear about which aspects of these you will be speaking about if they ask you about the work experience. And there may be questions related to any interesting case you saw, any difficult case, any procedure that you observed. So do some reflective learning on these. Try to understand which aspects of the patient's care affected you, how you would be using this in your interview practice. Of course, you would have covered exams which are part of the interview process, like the UK CAT, the BMAT, and others. And according to the universities and the countries you apply, these differ. These are specific to the UK ones. And after this, you have the shortlisting and interview process, which probably you are now waiting if you are entering it this year. And if you're planning it the next year or two, obviously you have time to orient yourself and prepare better. So if you are appearing for the interview anytime soon, please remember that you cannot be prepared for every single question. And this actually applies to any interview process, whether it is for your job, whether it is for selection to universities, and so on. There are some questions which you would be expected to be prepared for. These may include those you have mentioned in the personal statement, which I mentioned just before this. But apart from that, try to acquire a broader knowledge base. And what I'm going to cover in the next 30 to 40 minutes, or possibly longer, depending on how it goes, is to give you an overview of the medical aspects of it. Of course, there are many non-medical aspects. There are systems related to how the hospitals work, how team working works, leadership skills, clinical governance, how the NHS works, how you have a referral pathway, ethics of medicine. So there are so many different aspects. Communication skills will always be an important aspect. Team working will be an important aspect. Multidisciplinary care. So you should be prepared with all these as well, which I won't be covering today, but there are a few videos on communication skills on my channel. I will add this to this playlist as well. The main important aspect is to focus on strategy. So as I said, you cannot be prepared for every single question. So you have to have a plan as to how you would approach the answer. You should try to start speaking without much of a pause. The easiest way is to give an introduction to your response, which will be a kind of repeating the question in a slightly different way, or explaining what you have understood of the question first. So this gives you an advantage of reiterating what you have listened and what you have understood. So if the examiner feels you have understood it wrong, it can be corrected before you actually start the response. It also gives you a few seconds to bring the thought process into flow. The interview assessment happens fairly quickly as you start speaking, and if it is a MMA model, you just have 5 to 6 minutes in a station. You would only see that examiner or interviewer for that short, brief time. So during that time, you have to cover as much as you can. So give an overview or broadly mention the main subheadings you would be covering. So whenever a question is asked, you know what specifically you would be covering. So bring those points in the beginning and then start elaborating on any of those points, and the examiner can pick any other point as well if that interests them more. So the discussion would start after that process, but you need to really show that you're confident. You need to show your thought process is working well, and you need to show them that you have a few points that you would like to cover. There is no absolute right answer. Be relaxed and confident. The examiner looks at your approach more than what exact answer you are going to give. So in this next few slides, we'll be looking at the process of decision making in medicine. You may not be asked directly about how you make a decision, but you'll be given examples of problems that you face and how you would approach them. So this will give you an overview of how to put that answer in perspective. So decision making is a complex process, and it becomes easier as you acquire more experience. We have to gain information from various tools. So I'll be going through them. For example, you start with the history taking, then look at the clinical examination, you plan a series of investigations which may help you diagnose, and then you combine them and you apply your clinical reasoning. Of course, you don't do tests routinely, and you do tests rationally when you think it will help in a sequential manner as possible. And then the clinical management would come, where you apply the results and the clinical diagnosis and give the appropriate treatment. Sometimes it may be just observing, sometimes it may involve antibiotic treatment, and so on. So if you have a systematic approach, it should not fail. A quick mention of what you would cover in history taking. So history taking is a format where we are looking into the symptoms that the patient presents with, and we try to get more information. We also try to get information that may affect the course of the patient. So we look at the presenting complaint and the history of the presenting complaint, which is just a detailed expansion of the presenting complaint itself. You would follow in sequence. You would have a thought process depending on what presenting symptom. For example, if he just comes with fever and cough, you would ask about the duration of the fever, the degree of the severity of the fever, when the cough started, is there any productive sputum, is there any pain in the chest, is there anyone else in the family affected, and so on. So all these related complaints would be eliciting. That's the history of the presenting complaint. So you also go for past history, which would include procedures and surgical procedures as well. The history of medication is very important, especially if you're going to prescribe something new. That may be drug interaction. And also when we are admitted in hospital, you have something called a checklist of the medications, and you need to be making sure that everything is clear, and the medications that should be reconciled or continued should be mentioned in the medicine reconciliation. The diet history and allergy history are very important as well. You would also go into family and social history. In adults, you would be asking about habits like alcohol, smoking, and drug abuse. Consanguinity is an important question when it comes to children, and especially with malformations. Vaccination history is very important in children, and also a history of travel, especially with current epidemics and pandemics of diseases. You need to ask about travel history. So try to get the sequence into your mind, so you don't need to think much about if they ask you what would be your approach to history taking. So you can have a summary of this. So presenting complaint, a focused history based on the presenting complaint, past history, medication, diet and allergy can go together, and family and social history, and vaccination and travel history. The next step is clinical examination, where you have a general assessment. During this process, you look at the growth, centiles for weight, height, and also the BMI, which is the body mass index. So obesity is a major problem, and we should be able to answer questions related to obesity. You should know the range for the BMI. You should know what are the factors that contribute to the rising incidence of obesity, and so on. You should also have the vital signs review at this stage. Usually your nurse would have done the screening, and you would have observed during your observership period that the nurses do the vital signs and enter them in the system or on a sheet according to your system. So heart rate, respiratory rate, temperature, saturation of oxygen, and the blood pressure are the most important, in addition to the growth and the BMI part. Then you look at the patient, you introduce yourself that you are going to examine, and you warm your hands if you are in a cold place. Make sure the patient is happy to be touched before you touch them. So you have anemia looked at in the eyes, so you look at the conjunctiva. You also ask them to put out the tongue, so you can look at the sclera for jaundice. You look at the nails for any features of iron deficiency, like flat nails or clubbing can be observed as well. You look at the skin in general for the healthy appearance of the skin, the cleanliness, and any rash, and you can comment on their hair or dysmorphism as well. You next go on to the examination of the head, eyes, ear, nose, and throat, which is in short hint. So you would look at dysmorphism, you would look at any congestion, you would look for rash, you would look for the throat examination with the tonsils assessment, you would look at the dental hygiene, and so on. And then you look at the general findings like capillary filling time, which is an indication of the perfusion. So if the patient is not perfusing well, it's an important sign, because they may start appearing to go into shock or hypotension. That's a sign of sickness. You would also feel the peripheral pulses, which is mainly the radial pulse and the brachial pulse. You can also feel the dorsalis pedis. The central pulses would be the carotid pulse and the femoral pulse. You examine then the different systems. So you would focus on the system which is related to the presenting complaint. For example, if he's presenting with cough, you would focus more on the respiratory system, but usually you look at the other systems as well. So if you're looking at the cardiovascular system, you would feel the pulses, the heart rate, heart sounds, murmur, blood pressure, and the neck vessels. You also look at the respiratory system, including respiratory rate, effort of breathing, whether there is distress. Listen to the air entry on both sides, whether there is any added sounds. When we say added sounds, we are relatively mentioning crepitations, which is like crackles, and wheezing, which is the expiratory sound you hear with the narrow airways like in asthma. When you look at the abdomen, you're looking at if there is any distension. Then you look at any tenderness. You ask the patient if there is any pain, and feel for the liver, spleen, and any tender area, as well as for bowel sounds. In terms of central nervous system assessment, you look at the conscious level. You sometimes have coma scores, which you can be familiar with, the Glasgow coma score, a simple assessment like the AVPU score, which is the alert, response to voice, response to pain, and unresponsive score. So you categorize them according to this level of response. Examination of the cranial nerves, motor and sensory systems, and the reflexes. Then you look at the genital assessment if it is appropriate. Obviously, it's involving the modesty. So again, permission is needed. If it is a child, you need to ask the parent, and if it's an adult, obviously you only do it if it is essential. Hernial orifice in case there is a history of hernia or concern. And other focused assessment, if there is a rash on the back or if there is a skeletal problem, you look at that area as appropriate. After the history and the clinical examination is when you go for workup or investigations. Of course, not all cases would need an investigation. So you would have to rationalize your approach depending on what you think is the main differential diagnosis. So we call it a differential diagnosis because no single pattern will fit a specific diagnosis all the time. Of course, there are certain conditions, like if you have a child with Down syndrome, that will be a quick spotter-like diagnosis. And there are specific conditions you can diagnose quickly, but most of the times you form a differential diagnosis and then you narrow it down depending on your assessment findings. The investigations would depend on your top differential diagnosis. So you need to have one or two differential diagnoses which you would like to rule out first, and then you plan the lab tests and procedures or imaging as it may be appropriate. In terms of lab tests, we have different labs which are involved. So hematology would be including blood count, peripheral smear, blood group, and if you have specific cytology related to blood disorders like leukemia, you do a bone marrow aspiration biopsy. So hematology basically leads with blood parameters related investigation. Biochemistry, as the name suggests, deals with the lab where the chemistry is measured. So you have the serum electrolytes, which include sodium, potassium, calcium, magnesium. your serum protein levels, the liver function test, or kidney function like creatinine, urea. Blood glucose is of course included. If you have any endocrine condition, you may measure the thyroid hormone or insulin level or cortisol as appropriate. You have testing conditions for some of these, like if you do lipid profile, you need to be fasting for that. So all these instructions, and the lab will have specifications on how much sample they need in what container. So you need to take it related to that. Microbiology relates to organisms which produce infection. So it starts with gram staining, where the fluid you are checking is smeared with gram stain, and then you assess under the microscope whether the bacteria is gram positive or gram negative. Gram staining also applies to any growth on the cultures. So culture is just a way to allow the bacteria to multiply, so you can identify. So you culture the blood or any body fluid in specific culture medium. You have specific medium for aerobic bacteria, and you have specific medium for anaerobic, which are more difficult to grow. Then fungal stains are available as well to look for fungal hyphae, and you can also culture the fungus. The PCR based testing is very important as well, and genetic studies would include karyotyping, specific panels for suspected testing, broad testing like microarray, exome sequencing, whole genome sequencing. So all these are very recent developments. You are expected to know a little bit about whole genome sequencing, for example, which is a very important recent development, and it might change the way we approach diagnosis. Imaging relates to radiology-based investigation. So we have X-rays, which can be of the relevant body part like chest, abdomen, limbs, and skull. The CT scan is generally a quicker test, though it involves radiation exposure. It's good for imaging the skeleton, and it can pick up bleed in the brain as well. It can be used for specific areas like looking at the sinuses. It can be looking at the abdomen. Visceral trauma can be picked up as well. Contrast studies are used for gastrointestinal, renal, and vascular systems like angiography, for example. And in gastrointestinal tract, you have a barium swallow or a gastrographin swallow to see if there is any obstruction. Magnetic resonance imaging or MRI involves no radiation. It's quite a good test for imaging structure. So structural detail of the brain or the lungs and other organs can be clearly looked at. And MRI takes time. It's in a cold environment, so the patient may need to be sedated sometimes if they are agitated, especially children. And you also have radioisotope studies where you use a gamma camera after you inject radioisotope material. So it can focus in specific areas like technetium scans, and you get iodine scans looking at the thyroid tissue, for example. And you can also do a skeletal survey, which may show you either signs of systemic infection localizing in the bone, or it can be metastasis from a cancer which is spread to the bone, and so on. You also have specific procedures which may involve biopsy of different parts. It may be a swelling, it can be a lung biopsy, it can be a liver biopsy, and as I said, you can do a bone marrow aspiration, which is a type of biopsy as well. Lymph nodes can be sampled, and all of these are studied by histopathology, which is a lab study looking at these tissues. Once you have the above information, we arrive at the likely final diagnosis. The continuous evaluation of the response to treatment, further testing and modification of plan as part of the ongoing management. So if they ask you what will you do next once you have started the treatment, you have to say that I would continue to evaluate, keep in touch with the patient if they are outpatient, or continue to monitor them if they are inpatient, and review the response and titrate your response accordingly. In terms of the treatment plan, you have symptomatic treatments which are not specific for a condition, like paracetamol for fever or using a nasal spray for nasal congestion. And you have specific treatments according to each individual condition. So once you have a specific diagnosis, you can go for specific treatment like antibiotics, antivirals, antifungals for infections, as the case may be. If it is a tumor, you have to differentiate benign and malignant tumors, because approach to treatment would depend on that. Malignant tumors are more difficult to treat. You need more extensive treatment. So you have surgical and non-surgical treatments according to the case, and you have radiotherapy, chemotherapy, and so on as well. If it is a surgical condition like intestinal obstruction, for example, you may need to operate. Appendicitis is an example of a surgical condition which needs an urgent operation as well. So I will be continuing this series the next time I get to do this, or I will post it as a recorded. So we'll be looking at all the organ systems as to how the body works. So I hope this is useful to you, and I've stopped with this. Of course, I'll share the recording as well for you.